Okay, next genus we're going to talk about is Bacteroides. And we're back to the anaerobes. Remember our ABCs. We have actinomyces. We're finally going to hit the B, Bacteroides, and we already talked about Clostridium. So Bacteroides is also part of our normal flora. It's part of the normal flora in the gut and in the colon, where the species Bacteroides fragilis is not the most common species in the gut of Bacteroides, but it's the one most frequently associated with disease. Now, again, the genus Bacteroides overall is the predominant anaerobe there. Not fragilis specifically, but fragilis is most often associated with disease. Transmission is endogenous, and we typically think about this for trauma, for surgery, where something happens and organisms get released from the colon, they get into the abdomen, they get into the blood, so we can talk sepsis here. So transmission is typically endogenous, but there's a predisposing factor like some kind of surgery or trauma that predisposes you to infections with Bacteroides fragilis. As far as the virulence, my guess is they're not probably going to ask you about virulence for Bacteroides. It's good to know, though, that the LPS has reduced endotoxin activity, and really that makes good sense. If this is the predominant species in your gut of anaerobe, you probably don't want super pathogenic LPS in there. So this is actually probably not a bad thing. It does have a capsule that's anti-phagocytic, as most of the capsules are, but again, I don't want you to focus so much on the virulence here. Now, what are the diseases associated with fragilis? Sepsis, gram-negative sepsis. This used to be the leading cause of gram-negative sepsis, but now we prophylax a lot during surgery, in cases of trauma. So this has actually now gone way down, where E. coli is now probably the leading cause of gram-negative sepsis. You also see peritonitis and abdominal abscesses. And again, remember, when we're talking an anaerobic infection, we're talking a mixed infection and we're talking foul smelling. All right? So remember those two things for Bacteroides. Now, how are we going to diagnose them? They're probably not going to ask you about diagnosis. You have to go through specific biochemical tests, and again, that's probably unlikely to show up. How are you going to treat it? Well, these are actually resistant to penicillin and a lot of cephalosporins. So you have to treat, and the prophylaxis drugs here are usually metronidazole and clindamycin. And like we talked about for a lot of other abscesses, the abscess has to be drained. Prevention goes back to prophylaxis. So prophylactic antibiotics given during any kind of manipulation of the GI tract, whether it's the gallbladder or anything associated with that, or surgery. You're going to prophylax to prevent infections with Bacteroides.